Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Today I wanted to talk about something many have probably not heard of. It is called the endothelial glycocalyx. The reason I care about the glycocalyx is it is related to vascular function. Vascular refers to blood flow. Briefly, I will go over a couple of definitions. The endothelium is basically the cells that line the inside of your blood vessels. These are the veins, arteries, capillaries. I'll read from a list of some of the things that are important with your blood flow so I don't leave anything out. The vascular system helps to deliver oxygen, nutrients, and hormones to your organ systems. It also helps to control the immune function with regulating inflammatory response and antioxidant response. The vascular system is also responsible for controlling coagulation or clotting. Blood vessels have an important effect on regulating blood pressure as well. Dysfunction of the endothelial layer results in cardiovascular disease, hypertension, stroke, diabetes, and even erectile dysfunction. So now I want to talk about what the endothelial glycocalyx is. As we said, the endothelium is the single cells that line the inside of your vessels. The glycocalyx is a layer of glycoproteins. Glycoproteins are a starch molecule attached to a protein, and these look like grass when you look at a blood vessel with an electron microscope with a lot of magnification. The glycocalyx responds to mechanical and chemical signals from the blood. It helps to regulate immune function as well as permeability, or what comes in and out of this layer. The glycocalyx functions as an antioxidant, and when it does that, it removes these oxidants from the bloodstream. Oxidants are substances that cause damage to other portions of your body. The glycocalyx also regulates blood vessel tone with a substance called nitric oxide. Nitric oxide has been shown to be a vasodilator. Vasodilators increase the blood vessel size to allow more blood flow. One of the things that damages the glycocalyx is hyperglycemia, or elevated blood sugar. I have viewed electron micrographs of patients that have no sugar versus those that have high sugar environment in the bloodstream. The glycocalyx is almost non-existent and non-functional in those that have high blood sugar. There are many scientists that believe that cardiovascular disease is really just diabetes. The response of the glycocalyx to sugar is support for this argument. I'm interested in root cause medicine, and if diabetes is the root cause of vascular disease, then I would surely like to prevent that. Lifestyle modification is very important in decreasing blood sugar and its effects on your body. In medicine, we always try to come up with some kind of pill that we can take to improve our problems. These sometimes work, sometimes do not. I am aware of a product called arteriosil that may in fact stabilize the glycocalyx. It is made of seaweed. The study results I have seen are promising, but I don't have enough experience with this yet to be able to fully endorse this. Other people that are interested in vascular disease, if you think about the whole process of atherosclerosis, your immune system is intimately involved in this. Previously in other videos, I've talked about improving immune function, so if you use those tips to improve your immune function, then you may be certainly at less risk for vascular disease. One of the immune type of cells that has been found in atherosclerotic plaques in abundance is mast cells. And mast cells are those things that respond with histamine release when stimulated. People have tried antihistamines and mast cell stabilizing medications in efforts to decrease cardiovascular risk as well. There are some supplements that tend to regulate mast cell function. A couple of those are quercetin and resveratrol. I don't know how well these items will work to decrease your cardiovascular risk, but I suppose probably minimal risk with trying these medications and supplements. For me, it comes down to lifestyle modification probably being the most important factor here. You may not have heard of the endothelial glycocalyx. It is being researched and studied quite a bit, and it interests me because it's directly affected by high blood sugar. High blood sugar is something that you and I can control by what we eat, by exercise, etc. If I can find the root cause that's going to cause disease, then I'm going to try to prevent that. If you're my patient, I hope you can use this information to your advantage. If you're not my patient, then please see your own doctor to discuss your medical concerns. This is Jason Williams, DO. This is the Williams Family Medicine Channel, signing off.